Hello, and thank you all for joining us for the Women in Cancer Educational Series. We're excited to welcome Dr. Christina Tian to present on acupuncture in cancer. Before we get started, I wanted to make a few notes. This webinar is being recorded and will be sent out to those who have registered. At the bottom of your screen, you will see a CC button, which will turn on closed captioning. And additionally, you can submit your questions in the Q&A box, which will be answered during the Q&A section at the end of the webinar. Dr. Tian is a second-generation doctor of Chinese medicine, specializing in acupuncture and Chinese herbal medicine. Dr. Tian has advanced oncology training and clinical experience, which she shares with patients and medical professionals through national and international speaking engagements. In addition, she has over 12 years of clinical experience training Olympic and professional athletes. Having administered hundreds of thousands of acupuncture treatments, Dr. Tian employs a range of acupuncture techniques, including gentle acupuncture methods. Previously, Dr. Tian served as chief acupuncturist at Sibley Memorial Hospital, providing oncology patients with traditional Chinese medicine services, including acupuncture. Dr. Tian, thank you so much for joining us tonight and sharing your expertise, and I'll let you get on with the presentation. Thank you.
Thank you so much for introducing me and having me tonight. It's a pleasure to be able to discuss and hopefully educate everybody a little bit more about traditional Chinese medicine and acupuncture, especially as it pertains to women's health and cancer treatments. So let's jump right in. And at the end, like I said, we'll have time to ask me as many questions as you like. All right, so let's first talk about the basics. What is traditional Chinese medicine? We can't really talk about acupuncture without really understanding this concept. And it's a very different concept from the medical system that most of us know in the United States. So traditional Chinese medicine, otherwise known as TCM, is used across the world in over 183 countries. It is an entire medical system, the second oldest in the world. The first is actually Ayurvedic medicine, that's been used for over 3,000 years old. Some say 4,000, 5,000, depending on where you see the literature, to prevent, diagnose, and treat diseases. It utilizes a wide range of therapies, which includes acupuncture, dietary changes, herbal therapy, which is what we call pharmacology in Chinese medicine, meditation, physical exercise, massage, and everything you can think about, like life habits, is a part of TCM. And it really looks at the body as a whole. So instead of looking at the disease and treating the disease, it treats the body because it treats us as if we're a complex, interconnected system. It's very interesting to think about it this way because usually in America, we think about, okay, well, there's a disease, so let's treat that. But in Chinese medicine, they treat the entire body from the inside out. It aims to restore what we call balance and harmony for optimal health. And that may sound a little bit, esoteric, but it's not. Like balance and harmony is like balanced hormones, balanced immune system, meaning not too much, not too little, just right. It's a very holistic approach. It addresses not only physical symptoms, but emotional, mental, and spiritual well-being. In fact, one of the first reporters to visit China on a visit in the 80s came back and said, there's no such thing as psychology in Chinese medicine. And the reason for that is because it's all one medical system. It's all inclusive. Chinese medicine is generally used as personalized, tailored treatments, depending specifically on what the provider sees, from what we can consider tongue, pulse, or other objective findings, and of course, what we report as our symptoms. We really take these lists of different findings, empirical findings, and then we generate a different diagnostic system based off it, and we give you a diagnosis and treatment plan accordingly. It comes into effect, it's really interesting because one of the favorite parts about this medical system is that where you live, your genetics, what you eat, what you drink, how you live, exercise, your life habits, and the weather outside can affect how you feel. And one of the simple examples are, a lot of people get headaches or more pain when it's about to rain. So Chinese medicine discusses that as a part of the medical system. So let's talk about what's most interesting tonight, I think, is acupuncture. So very briefly, acupuncture is used as a type of therapy with a very high safety profile. It has virtually no side effects when performed under licensed and competent hands, except for perhaps some bruising and mild discomfort depending on what type of needle they use. There are no drugs or injections generally used in acupuncture therapy. Now, there is something called acupuncture injection therapy that does have injections, but you'll rarely see that. I think in the DMV area only, acupuncturists can only do that in Maryland. They used to be able to do it in DC as well. It is utilizing acupuncture needles, which are considered FDA medical devices since 1996. So again, acupuncture balances the entire body. Think about energy. So energy is pretty easy to feel and think. Your heart literally beats and creates an electrical impulse through your body. So it literally controls that energy. So when it controls energy, it can control everything energy controls. So let's say you have blood. We all have blood, hopefully. We have blood in our systems. Well, how does it move? Something energetic creates movement in the body so that the blood can circulate. And that's really important. So the acupuncture needles affect directly the energetic system, which then affects everything else, blood flow, hormones, neurotransmitters, everything you can think of. So when we insert needles into acupoints, that is what we call acupuncture because it requires a needle. Now, acupressure is different. It's when we use anything, including our own fingers, to press on certain points to create pressure that triggers a similar response, though not always as strong as acupuncture needles. In the biomedicine perspective, the needles are believed to activate and regulate a cascade of different systems in the body. So you can take a look here, the endocrine system, the immune system, sensory systems, digestive, gynecological systems, musculoskeletal systems, respiratory systems. So there's quite a few systems that it can actually balance. And the research is pretty clear that it actually treats every single aspect of the body. And when you put acupuncture needles in somebody, it can change everything from your brain to your blood flow and your body temperature. All right. So this is a slide that's a short synopsis about the facts in the United States only. So we're only looking at one country out of the 183 plus countries, according to the WHO, that uses acupuncture. This data, some of it is a little bit old, so the 2002 data, but basically, since the 70s, there were over 10,000 randomized controlled trials that were conducted showing that acupuncture therapy was increasingly effective and accepted as a therapy worldwide. And the WHO reports that in 2002, this many number of countries actually were using acupuncture for multiple different conditions: dermatology, neurological, psychiatric, gastrointestinal. Of course, pain is the big one. There are quite a few studies out there that show a significant reduction in cancer-related fatigue, including some more recent ones from MSK. There are a few systematic reviews out there that show that acupuncture was significantly associated with the reduction of pain as well, compared to actually regular medications too, and in conjunction with regular medications. And the reason why that is so important is because acupuncture is safe to use with any medications for the most part. So this great study with this peace trial was basically conducted that found that acupuncture produced greater pain reduction than usual care among cancer survivors of chronic musculoskeletal pain. And the usual care included, of course, medication. And of course, in 2022, researchers decided, after analyzing quite a few systematic reviews of acupuncture, that acupuncture is immensely underutilized in the United States in both health policy and clinical practice. So some of the symptoms that are definitely responsive to acupuncture with patients with cancer are fatigue, dry mouth, lymphedema, pain, insomnia, neuropathy, hot flashes, anxiety, depression, and of course, nausea and vomiting, which is one of the earliest studied ones. Now, this was compared to waitlisted and controlled conventional care, so medications as well as no care whatsoever. So now we're going to talk a little bit about where acupuncture can help you depending on what stage you're in. It's really great because we have patients that come to our center with a variety of different ailments and are different stages. We have patients that come at their initial diagnosis. They already knew the science about acupuncture. They wanted to get ahead of everything. They wanted to come in right away. They needed the help. We have patients that come during chemotherapy or during radiation therapy. We have patients that come preoperatively and postoperatively, and we have patients that are trying to use acupuncture while using aromatase inhibitors to manage the side effects. We have patients that are on no medications whatsoever, finished all of their cancer care, but just want to kind of stay with a more balanced system. And so they come after recovery and for survivorship. And at the very end, we're going to talk about herbal supplements and traditional Chinese medicine with herbal supplements, which I think quite a few people must be curious about because I get this question in my clinic all the time. So let's talk about initial diagnosis. So the most effective part about acupuncture and most interesting part is, as I said before, it's a systemic type treatment. So it's not that I put the needle in a location and then that location just gets better. That location does get better, but it's also that that one location can manage multiple different systems inside the body. So there's a lot of research in this, and there's a lot of long, fancy scientific words that I will definitely skip over. But basically, it gives your immune system a lot of support. It regulates the immune system. So, for example, if somebody has an overactive immune system, like autoimmune disease, it can actually regulate that. And if somebody has an underactive immune system, it can also increase the immune system. The acupuncture needles stimulate the whole body to self-regulate. It can also decrease inflammation. Now, when we talk about cancer, we're talking about usually immune system issues with inflammatory issues. So again, acupuncture decreases systemic inflammation throughout the body, regardless of where you put needles, apparently in some studies, but other studies, they show it's very important where you put the needles. And it stimulates the release of neuropeptides and endorphins also to inhibit inflammation through neural pathways. Of course, when we first receive a diagnosis, there's a lot of stress, a lot of anxiety, perhaps even depression. Acupuncture is excellent at modulating and changing up your neurotransmitter levels naturally. So you can do this with medication, or you can do it just with acupuncture to feel really good mood regulation, reducing anxiety and depression, helping you live day to day and a higher quality of life. It also helps with sleep improvement, which is, of course, important for all of us because sleep improvement is usually important when we heal. So in Chinese medicine, we really only heal when we're sleeping really well. So in conventional biomedicine, we also see that there is a circadian rhythm of the clock. And if we're not sleeping a certain number of hours, our body is not able to reduce our inflammation. So acupuncture has always been shown in research to release neurotransmitters, hormones like endorphins, serotonin, and cortisol levels to regulate. It promotes the body's natural circadian rhythms for better sleep quality. So even though you may feel sleepy right after an acupuncture treatment, you usually sleep very well that night. That's a common feedback that we receive. Right. Let's see if my slides are working or not. We're having a little tech issue here, so thank you all for your patience. Okay, so let's talk about acupuncture during treatment phases. So the main two that we're going to discuss at this point is going to be radiation and chemotherapy. So again, acupuncture stimulates the release of endorphins and blocks pain pathways. There's actually newer research that says that acupuncture actually retrains all of your nervous system to recognize what is maybe pain now is no longer pain after treatment series. It's very fascinating research that they're doing with the brain and understanding acupuncture. So it's very good at regulating pain. And that's wonderful because one, sometimes the pain medication isn't enough. And two, sometimes you don't want to take the pain medication or you can't take the pain medication. So what we usually see in clinic is when following an appropriate treatment plan, patients usually drop from anywhere from 8 to 9 out of 10 to about 2 to 3 out of 10 when we're treating them with acupuncture. And they consider that relatively manageable depending on the type of pain. And usually, depending on what's causing the pain, it does resolve over time in a lot of cases. So early on, in many studies, acupuncture was shown to reduce nausea and vomiting. It regulates your autonomic nervous system. So it actually regulates the entire gastro system. So loss of appetite, heartburn, nausea, vomiting, anything you can think of which is digestive related, acupuncture is actually excellent at treating. And there are some acupressure points that you can use. If you've ever heard of a C-band that you wear on your wrist, that is an acupuncture point that they're giving you. It's a little bit off in the instruction manual, so I have my patients always bring me their C-bands in so I can help them. But basically that point is called PC or P6 or NAG1 in Chinese, and it is used to very effectively treat hiccups, nausea, and vomiting. And those are very important parts of self-care. If you wear the C-bands almost all the time, even with or without Zofran, you'll feel a dramatic difference in your appetite and your nausea and vomiting symptoms and hiccups. So let's talk about chemotherapy-induced peripheral neuropathy. So this is one of the most commonly seen conditions in our clinic when it comes to cancer care, because it is highly resilient to medications, and it really requires a lot of love to heal sometimes. Acupuncture increases blood flow and microcirculation in affected areas, so hands and feet when we focus on this area, and helps heal nerve tissues and reduce neuropathy over time. So the neuropathic pain usually gets better faster in our clinic than the actual numbness, but both do see significant results. In a trial of about 75 cancer patients, acupuncture, so we call real acupuncture, not placebo acupuncture, significantly eased chemo-related peripheral neuropathy pain compared to placebo. They experienced less pain, tingling, and numbness. So acupuncture has been shown to decrease fatigue and increase energy. In a I think it was 2 years ago, Memorial Sloan Kettering Cancer Center did a study about this. And this is helpful for not just during chemotherapy, but radiation as well. So it helps the body balance the stress response and hormone levels, which improves our energy level. It's also been associated with helping sleep quality. So the more that you sleep better, the less fatigue you usually have. Okay. So a lot of patients will experience dry mouth during treatments, and it does actually stimulate salivary gland function, increasing saliva production by activating the neural pathways that actually control this. In a clinical trial, quite a few clinical trials, but this one's the most substantial. This is really radiation-induced dry mouth. It actually helps even better than standard care and sham acupuncture. Sham acupuncture is the comparison to what we call real acupuncture, which is when they take needles or they take what we call fake acupuncture needles and treat patients. And also shortness of breath is greatly reduced with acupuncture. And when you're going through chemotherapy, that is one of the major symptoms a lot of our patients complain about, how going up a flight of stairs becomes very challenging, and they show that they feel much better afterwards. Right. And constipation, diarrhea. So again, acupuncture is regulating as a type of treatment. So it doesn't increase and decrease without cause. It actually regulates your entire digestive system. So it can actually manage both constipation and diarrhea with almost the same acupuncture points. Okay. This is one of our favorite topics. We see a lot of patients before and after surgery, especially breast surgery right now. And acupuncture is shown to reduce inflammation, which I've already said a few times, and reduce anxiety levels. But what we have noticed, and the surgeons agree, is that the treatment protocols we give them greatly increase their odds of healing faster and better with less chronic pain over time. It is great because you can actually use acupuncture in the operating room. Before, several years ago when we were still at Sibley, we were actually trying to pilot having it during bariatric surgery to help control nausea and vomiting for patients. And acupuncture during surgery or even right after surgery is very beneficial. The sooner you can get it after surgery, the better. We were also going to do hip replacement surgeries where we would do acupuncture in the PACU. So it's very safe. Again, you can use it with any type of medications or other medical procedures. In fact, you can, if you really like to YouTube things, you can YouTube acupuncture open heart surgery, and they use it in lieu of general anesthesia, and the patient is awake the whole time. So it's very interesting. But what I love about acupuncture is, and we mix it with a few other therapies in the office, different types of infrared therapies, is that it really increases blood flow to the surgical site afterwards and enhances tissue oxygenation. It can decrease keloid scarring, and it can increase basically rapid healing and reduction of swelling to the area. It just facilitates better wound healing overall as well. Sorry about my mouse. Let's get here. All right, so this is another really popular topic for us, acupuncture and aromatase inhibitors. So usually patients can complain of different side effects or adverse effects from aromatase inhibitors, such as joint pain, hot flashes, some menopausal symptoms other than that, and depression. And acupuncture is shown to greatly decrease joint pain. It has been shown to decrease joint pain of many different kinds, but especially aromatase inhibitors, and it also increases sex drive while decreasing hot flashes, which is a little different from the medications. Again, you'll see a lot of the same things. It balances out your hormonal system. It reduces the frequency and severity of hot flashes. Usually, our patients will say that there's at least an 85% improvement in joint pain and hot flashes. It may not be perfect, but they feel like they can go hiking, they can get through the day-to-day, they can go out to dinner with friends without being afraid to like fan themselves the whole time. It's a great way to increase your quality of life. And so after all of your treatments, you'll wonder if I should even bother with acupuncture because I'm through everything now. And a lot of cancer survivors face lasting physical and emotional issues, such as pain, fatigue, anxiety, inflammation, and a dysregulated immune system. So we usually utilize acupuncture still. We have patients that come once every other week or once a month, and they've been coming for maybe a decade, 2 decades, and they feel great on it. It really manages their anxiety. They feel like their energy is great, their immune systems are great, they don't get sick nearly as much. And they can use it safely with their other medications. There's very minimal side effects with acupuncture, like I discussed. Some bruising can occur because it is a very small needle, but the needles are very fine. You can fit, I believe, 20 acupuncture needles in a needle that you normally get as an injection. And it never causes a rebound effect, unlike other treatments. So when you stop acupuncture, you may lose some efficacy here and there, but actually most studies show that acupuncture has a high endurance value. So even after 6 months of checking in for such conditions such as pain or even neuropathy, patients feel good still without further treatments. So we always recommend this, and it's actually now considered a standard of care in the United States for cancer patients. That's recently, the Society of Integrative Oncology actually brought that to light. They've done a lot of great work on it, and I can share that information. They always love when patients and providers join their society with Kara afterwards if you are interested. But there's a great 3-year study involving 360 patients previously treated for cancer, and it revealed that acupuncture significantly alleviated chronic pain compared to standard of care. Standard of care includes medication, sometimes like PT and massage, which are actually excellent because in Chinese medicine, we use PT and massage as well. We just call it something different. And electroacupuncture reported significant reduction in pain severity. So electroacupuncture is something you'll hear about if you see an acupuncturist. And I highly recommend electroacupuncture now because it's now considered the gold standard when it comes to acupuncture for a variety of treatments, including anxiety, nerve-related issues, pain. The only time we don't use electroacupuncture is if you have a pacemaker, but aside from that, if you have the option of receiving electroacupuncture from your acupuncturist, I highly recommend it. A lot of studies show that it is anywhere from 20 to 70% more effective than actual regular acupuncture, so that you will get better effects from less treatment, basically. Good. Oh, losing your slides here. Okay, so we're near the end of our talk, so I went relatively quickly, but we can go back to any slide that you would like to ask me questions about. So natural supplements and traditional Chinese herbal medicine is a really hot topic. I believe there was a study done recently that about 1/3 of cancer patients will be using some type of natural supplement, whether their oncologist knows about it or not. And it's a big topic, so I'd like to bring it to light in this conversation. There are a lot of interactions between natural supplements, as simple as minerals and vitamins, to traditional Chinese herbal medicines. And there are a lot of differences that I see in this country where in China, it's different because traditional Chinese medicine doctors in China are actually mostly in large clinics and hospitals, meaning there's a whole hospital of just traditional Chinese medicine, and it will be located adjacent to the biomedicine what we call Western medicine hospitals. And it's they work together. The doctor from one hospital may say, you really need to go over there and see them instead. And in the US, we don't have that. So, you'll see a lot of studies online and you'll research it and you'll find these great herbal formulas. They're actually patented formulas as if they're drugs, because in China, herbal medicine is a drug. You have to have like a prescription for it. You can't just buy it on Amazon and start taking it. And the reason for that is there are a lot of interactions. And we really want you to be well educated on that, just for your safety and for your health. Okay. So there are different ways of tracking herb-drug interactions. Memorial Sloan Kettering's website actually has a tracker now that you can go and you can search up ashwagandha and, what does that interact with? What is it supposed to do? And why can't you take it right before surgery and things like that? But I really recommend you discuss this with your oncologist. And if you feel like, you could bring those studies about something to your oncologist, they're most likely going to be able to help you out a little bit more. We do work with city oncologists about this. I prefer not to give patients herbs because if your treatments are constantly changing, we don't know how you'll respond. So if you were taking any vitamins or herbs or something you found on the internet, please, please, please tell your oncologist so they can really manage your care and help you with the safety profile. I'm going to keep going back there. Here we go. Okay, and this is the next hot topic, which is how to find a qualified acupuncturist. So the number one thing is that I highly recommend you go to the state board website and verify if the acupuncturist is in fact acting. And this comes to light because I am actually on the Maryland State Board for acupuncturists. And sometimes you'll see an inactive license and you may want to just double check that they're actively licensed. The next thing is that if they are nationally certified by the Commission for Acupuncture and Oriental Medicine. Now, just so you understand, each state in the United States has a different list of requirements to receive licensing to be an acupuncturist. And that can be as little as almost no degree to as high as a doctorate level degree. And when states transfer licensing from state to state, they don't always care about how you got your license, but they rather will just reciprocally appreciate and accept the new license. So I really recommend you going to the National Certification Commission for Acupuncture and Oriental Medicine, which we call NCCOM, their website, and check out if the person has an active certification. This is important because they hold a standard of continuing education. So usually people that are, all of the providers that are actively licensed have hit a certain level of requirements. It is different from a master's or a doctorate degree. And just so you know, again, in the United States, you can just have a bachelor's degree and be an acupuncturist. Even if your bachelor's degree was not even in acupuncture, it could have been that you apprenticed in a state that allows apprenticing. So everything's different. So I highly recommend having a nationally board certified acupuncturist. And let me explain the different degrees really quickly. There's an acupuncture degree, there's a Chinese herbology degree, and then there's an Oriental medicine degree. And the Oriental medicine degree is just the combination of the first two, the acupuncture and the Chinese herbology degree. And this kind of pops back to the Chinese herbology question. I highly recommend that if you are getting herbs from somebody, that they are nationally board certified to practice Chinese herbology, because not every state requires that to practice. And also you talk to your oncology team at all times. Okay. One of the other parts is education and qualifications from certifications. So in the United States, not every single school will teach you anything about oncology acupuncture. I went to two of the best schools in the United States for it, for a master's and a doctorate, two different schools, and neither of them taught us anything about cancer and acupuncture. We had to learn it separately. Memorial Sloan Kettering offers a fantastic oncology acupuncture training course. And this is very different from somebody that's taken like a weekend course. It's not a requirement to treat patients with cancer, but I do recommend it because they go through everything from drug interactions to safety profiling, such as who can receive acupuncture and who shouldn't receive acupuncture. The practice type is actually quite important. So that's what we call availability for care. The reason is a lot of acupuncturists are part-time acupuncturists, but many treatment protocols, if you follow the research and the evidence-based studies, require quite a few treatments a week for it to be effective. And so what you'll find is that perhaps you find a great acupuncturist, but they can only see you once every 3 weeks or 4 weeks. And that doesn't really help your neuropathy. That really won't put a dent in some of your symptoms. So this slide, I would just pop this out there to say that I'm super grateful for my patients because they are the ones that usually come to me and tell me why they chose us to be their acupuncturist, and they usually have been seeing acupuncturists before and found these gaps. So it's something I just want to share with all of you to help you find the right provider for your team. So years in practice is important, generally speaking, and I apologize for that extra bullet point. I'm not the best IT person. Ideally speaking, when we were at Sibley, we required a provider to have at least 5 to 10 years of experience before they treated patients. I do recommend 10 years of experience only because the data about acupuncturists is that almost 80% of them stop practicing after 5 years. So you want somebody that has a thorough amount of experience. When you talk to them, ask them how many cancer patients do they treat a week to kind of gauge. Some acupuncturists specialize in one thing versus another. We have a lot of acupuncturists that love musculoskeletal, like pain in the sense of sports injury, a lot of people that like fertility treatments and only do fertility acupuncture. You just want to make sure you're with somebody who kind of specializes or at least has a special interest in your care and your condition. And this one is really important because we have a large number of patients that complain of this, so I'm bringing it up here. Is your acupuncturist able to offer you different therapeutic options if your blood work indicates you cannot receive acupuncture? So this is something that most oncology trained acupuncturists will know, that if your platelet count, your ANC count, or your white blood count, blood cells are under a certain amount, we should not be giving you acupuncture at all. Instead, we can change to different things, such as cold lasers, or what we use is magnet therapy, which is a type of acupuncture using a polaric system of the body to bring blood flow rapidly to different areas. You want these type of options because as you're going through certain treatments, maybe like chemotherapy, and maybe your ANC drops, we still want to treat you because the acupuncture helps regulate and improve your immune function, but we can't put a needle in you very safely. So we want to make sure you have those options. So when you're having a discussion with your acupuncturist for the first time, just ask them about what types of care they can offer, or just go on their website and see. The other part of this is, something that our patients still really appreciate, even though a lot of people have let go of the pandemic. Do they wear a mask and follow any type of advanced safety protocols? And how do they clean their rooms? We always say safety first for our patients. Many acupuncture providers work in a great, relaxing spa environment with other massage therapists. They're not really equipped for a medical type acupuncture situation. So you just want to understand if they're using hospital grade sanitizers, if they're practicing coughing or wearing a mask, and, if you feel really safe. And this is really only important if you are in a situation you have a compromised immune system. And it's a good question to ask all of your providers in advance. And that was a quick presentation, and I am open to any questions and answers.
All right, thank you so much, Dr. Tian. What a wonderful presentation, so informative. And I love that you ended it with how to find a qualified provider and the questions to ask. I think that's always usually the second question I get from patients when they're looking or thinking about acupuncture, so that's wonderful. We do have some questions in the Q&A. So first we'll start with lymphedema. So patients who have lymphedema, can they get acupuncture? Do they have to be careful of what areas those needles are going into? And if there are any benefits, what might those be?
Absolutely. That's a really great question. It's a very common one. So you can absolutely treat lymphedema with acupuncture. It's actually, there's a lot of research behind it, and the safety profile is still very high. Now, every acupuncturist will have a different take on this. Even when we're at Sibley, some of the acupuncturists treated it directly, some of them treated it indirectly. Just to reverse back to our conversation about how acupuncture is a part of traditional Chinese medicine, which is a holistic, comprehensive system. The way to treat lymphedema may not be directly on the limb that you have lymphedema on. Okay, so what we will do is we will treat certain points that control what we call waterways through the body that is causing the lymphedema, or the immune system through the body, and that will improve the lymphedema. A lot of practitioners will treat it directly. We usually don't in our practice. We usually treat it indirectly, and we find very good results.
Wonderful. Thank you so much. And I think that goes back to the importance too of finding those acupuncturists who have experience working with oncology patients. Definitely will help when they have that knowledge for treating lymphedema. All right, so going back to choosing an acupuncturist, someone in the Q&A wrote a question. What expectations should patients have in terms of receiving a treatment plan and a proposed number of visits? or how much time to kind of see results and symptoms?
That's a really good question. And the answer is it depends. It depends on the condition. It depends on a variety of different things. This is how we do it. And this is how, so my father is also a practicing acupuncturist as well. So just so you know, so I've been working in acupuncture since I was 8 years old. We always do a thorough evaluation, just like you would with any other specialist that you see. We want to understand your condition. We want to understand the timeline of your treatments. You know, are you doing chemo right now? Are you going to do radiation? Are you planning on doing surgery? How many surgeries? What type of surgeries? Usually you should expect that your initial evaluation, that your acupuncturist sits down and understands exactly what's going on with you and what your care plan looks like when it comes to your oncology care plan. After that, you'll discuss symptoms, and every symptom is treated differently. Some are more resilient to care, some are very easy to treat. So they will discuss with you after they really understand your condition and what you're going through, a more thorough plan. However, I will say that MSK has tried to do quite a few studies, and based on multiple studies for the last few hundred of years, acupuncture is best every other day. However, that is not very realistic for everybody. So usually we follow standard of care of twice a week for most conditions. That depends. If the condition is very severe, we still might have to do every other day for a short amount of duration of weeks and then extend past depending on what the treatment therapies look like.
Great. So again, talk with your acupuncturist that you are seeing. They'll help kind of walk you through that, answer any questions that you have about treatment plans. And you mentioned that one study, and then you mentioned another one. So I just wanted to note that I'll get those from you and include them in a follow-up for people as well, so we can get that out to everyone.
Sure.
So then another patient asked if you can elaborate on the electroacupuncture that you mentioned, maybe just like a little bit more about what that is,
Yeah.
maybe the difference between the two as far as maybe benefits.
Yeah, of course. Electroacupuncture is very similar to regular acupuncture. It starts exactly the same way, where somebody will, hopefully, not everybody does this, but use rubbing alcohol and disinfect all the points. Then they will gently insert acupuncture needles into you, and they will make sure that there is mild stimulation, which is what I prefer for any type of oncology treatments. The less stimulation in the beginning, the better, and then you work your way up to more. They will then connect what we call leads, so basically cables, to certain acupuncture points, not all of them. Okay. And in those cases, when we're connecting those acupuncture points, we will turn on a small dial. Most acupuncturists have different devices. We use a Japanese device that's been used since the 70s to be shown to be very good at protecting the nerves. And what happens is that you feel tapping, like raindrops in certain areas. And some people might feel involuntary movement. It is never painful. It is never supposed to be painful, but it's very gentle and soothing. The acupuncture with that additional stimulation is basically sending signaling through the body repeatedly over and over and over and over again, more rapidly. So the chances of you getting better faster is also more rapidly.
Great, thank you. So moving on, someone wrote, if they're not currently experiencing pain or maybe not currently experiencing any symptoms, we can expand that just from pain there. Would acupuncture help avoid future pain or future symptoms?
So that's a really great question. It really depends, but like we said in the beginning, we usually treat a lot of patients at initial diagnosis, because if they're not getting any pain, the acupuncture will still moderate and change the neurotransmitters in the body and will help with the inflammation. So it's very preventative. In fact, the faster we can get ahead of it, the less likely people will develop symptoms. And in the years that I've been practicing, I should have kept count of how many cancer patients we probably see, but we see, and I think about 10,000 visits a year, roughly. So what we see is often, if you start before your chemotherapy, you will develop less treatments. If you start before your surgery, you will develop less symptoms every single time. Getting ahead of it is always good. Prevention is always a key in medicine.
So another question here about insurance. Insurances. So does insurance companies cover acupuncture treatment?
That is a great question. Health insurance is like car insurance. You get what you pay for. So if the insurance that you have through your company or you purchase on your own has what they call basically premium benefits, such as chiropractic and acupuncture, you'll probably have coverage. But you should know that this all depends on your insurance plan. They sometimes will cover you through only MDs practicing or NPs practicing, sometimes only through acupuncturists practicing, sometimes only for certain conditions. So that's really important to know. So if you're coming in for nausea and vomiting and they only cover for migraines, you might have an issue there. It is very complex. I have a team of 4 people that manage insurance for us. So I don't like to get into the details because then I get like an email saying, why did you tell this patient this? Because that's not true. And also acupuncturists, some take insurance and some do not take insurance. Some take insurance in network, some take insurance only out of network. It really depends. I really recommend you call the acupuncturists and like have a really good conversation with them.
Great. And you can also call your insurance company as well and just ask about general benefits related to acupuncture. All right, and then another question here. So in your presentation, you mentioned C-bands as kind of like something acupuncture related, acupressure related that patients can do at home. Yeah. Do you have any other like strategies or techniques or tools patients can kind of do at home that you recommend, like kind of in along with acupuncture?
Yes, we definitely do. Usually we go through a comprehensive evaluation, and then I give you basically 4 pages of text of what you need to read and what we recommend based on your constitution. So again, traditional Chinese medicine is based on how the person is. So there's no generalized treatment for anybody. The C-bands is a part of acupressure, so that's generalized because everybody has the same problem. They have nausea or vomiting in that area. Usually we give dietary changes, and your acupuncturist should always give you dietary changes based on what you need. Something as simple as don't drink any room temperature or cold water can really help with nausea and vomiting. Putting hot heating pads, like light heating pads over your abdomen can really help with nausea, things like that.
So we'll wait just one more minute to see if any more questions come in. Feel free to submit those in the Q&A box. We'll hold on for just a second here. I will let everyone know too, we do recommend patients go see Dr. Tian, so I have that information for you. Wonderful, it's on the slide there, and I'll send it out in the email follow-up that I send. So if you have questions, you want to make an appointment, you can reach out to Dr. Tian in her office that way. All right, so I don't see any other questions coming through here, so that's okay. We can end just a little bit earlier. Dr. Tian, is there anything else that we may have left off that you want to share, last final thoughts? I think you covered quite a bit tonight. Which is
it's a little bit dense, but ultimately you'll notice that in the slides, it kind of repeats over and over again what acupuncture does and how it helps multiple systems. And I think that's the most important part about acupuncture and traditional Chinese medicine, that when you get an acupuncture treatment, you're not just going for one thing. It recalibrates your entire body at the same time. That's why it treats neuropathy at the same time it treats nausea, at the same time it treats pain, anxiety, sleep issues. Literally everything is recalibrated in the body. It's a paradigm shift to think about medicine this way. So try to think of it not as what your symptoms are, but how acupuncture will recalibrate and rebalance your entire body in a treatment.
Yeah, I think that's there's many benefits to acupuncture, but I think that's such a great benefit that you're not just targeting one symptom. It can really help with an array of symptoms. You know, so it really kind of makes it such an effective treatment for patients.
So thank you all for participating tonight, and feel free to reach out to us if you have any questions. And thank you, Kara, for moderating for us, of course.
Yeah,
thank you
of course. Thank you so much for being here. Thank you everyone for joining us. And I'll also say a special thank you to my co-host, Janie Regler. She is here, but in the background, she has been helping and working with us on getting this done. So there she is. Wanted to give her a special shout out because definitely did not do this alone. So thanks everyone. And like I said, the recording will be sent out to everyone who's registered. So if you're here listening live, you can get all those wonderful slides again. You can watch this and get all the information. After I hit the end Zoom call here. You will see a survey that pops up, so feel free to fill that out just so we can get some feedback information from you. And then I will be following up with an email, so stay tuned for that. And if you have any questions for me, you can follow up with me through email or phone. You have my information. So thank you everyone for joining.
Thank you. Have a good night. Bye-bye.
You too.